Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. We appreciate the questions that are coming from around the world. It's really a pleasure to help everybody out. Okay, question number one. I'm 18 years old. I have thyroid problems since I was 4, which is quite amazing, and my white blood cells count is low. Well, first, yes, they could be interrelated. When your white blood count is low, it usually means you have a very compromised immune system. You know, I'm not sure all other details going on inside of your body. In our practice, we follow the numbers. We work on improving the white blood count. Obviously, you have an immune compromise. Your thyroid and your adrenal gland work hand in hand with each other. It would be tremendous to see your TSH, your T3, and your T4. Also, with the CBC, there's something called the differential. We would look at your monocytes and your eosinophils and your basophils. Those all tell us more about what's going on inside of your body. So I really can't give you an answer, just trying to propel you a little bit more. You're going to want to, very obviously, I want to show you this, my new book, Dr. Bob's Guide to Prevent Surgery. I go into great detail in the book about what you just asked me about the immune system with the white blood cells, etc. Dr. Bob, can eating too much garlic cause muscle and joint pain, muscle weakness? You know, I've never really heard that before. You know, we don't have a lot of people coming to the office with garlic, or they pretty smell like Italians. You also said, nothing against Italians, I happen to be Italian, so take that back. Let's talk about, you also mentioned about Baker's cyst. We have found that Baker's cysts are commonly a lack of oil, especially the omega-3 oils and vitamin B6. It's called tenosynovitis. Dr. Bob, I'm 26 years old. My 26-year-old son is scheduled for surgery to have his tonsils out. He has tonsil stones. We actually use a product called parotid tissue that helps that. And we also have, in the book, once again, we have a chapter on what you need to do to help prevent tonsils. It's so wonderful that we had all these people ask us questions in regard to the book. Dr. Bob, what you thinking about shingles vaccine for those over 50? Well, I want you to know I'm over 60. And what I have learned about viruses is that it's usually a lack of calcium, stress, vitamin D. So viruses can get in your body. I don't promote the shingles shot at all. We also use vitamin B6. So let me back up a little bit. Viruses get in because you don't have enough calcium in your body. We've also helped people who have an issue with their system because they don't have enough vitamin B6. I personally take vitamin D and calcium and B vitamins and a product called Agricept to help prevent me from getting any kind of virus inside of your body. I just would not do a shingle shot. Dr. Bob, in your book on preventing surgery, I'm supposed to get a hysterectomy. They just did a hysteroscopy looking in your uterus. What do I think? Most hysterectomies are because of heavy bleeding, sometimes endometriosis. You know, I don't know enough about you, once again, to answer you specifically. Work on your liver. Going back to the virus and the shingles, you want to stay away from sugar. Somebody had a question about Lyme disease, and they just wanted some help on that. And they had chronic stiff neck since the Lyme disease. You know, I purposely came into this room. This happens to be where we take films with our digital video radiographs, and we use digital video fluoroscopy. It'd be really wise for you to come and just visit us over here in Cleveland, Ohio. We see people from all over the world. You can come in, we can do some really specifics. Lyme disease can be quite challenging. Last question. What are the red bumps on your arms and on your thighs, etc.? We call those cherry hemangiomas, or little red bumps. Once again, it tells me that your liver has been compromised and you could have too much estrogen inside of your body. I want you to really track this book down. You know, this is my 9th book, and I know that once you read this book, it will literally change your life. There's 40 years of experience in here, on the top nearly 20 surgeries that so many people come in, and we're picking up the pieces of collateral damage. I'm Dr. Bob DeMaria.